Welcome back to Medical Associates Health Check. My name is Dr. Laisha Selvaraja. I am the clinical administrator and the head of accident and emergency. And back again is Dr. Adrian Ramkisoon. Thank you, Dr. Adrian, for coming back.
It's my pleasure.
He is our consultant urologist, and we've spoken to you about kidney stones before, but today's episode is a little bit special. We actually get to talk to you about real clinical scenarios, real patients, and you get to hear from our patients in their own words about their journey. So today we were talking about prostate diseases in particular, right?
Oh, yeah. So today we're going to be talking about the prostate. The prostate normally causes about three main problems, but we're going to discuss the most two common problems, and we're going to have live testimonials from patients who suffered from enlarged prostate, which could affect most men, 50% of men over the age of 50 years old, 70% of men over the age of 70 years old. So that's enlarged prostate, also known as BPH, benign prostatic hyperplasia. And we're going to be talking about prostate cancer and guys who had surgical intervention for prostate cancer and got cured. And the operation we did here was nerve-sparing radical prostatectomies.
And that's really important, but we'll get to that afterwards. So one of the things that we talked about, let's start with the enlarged prostate because it affects the majority of the male population after a certain age, does it not?
That's correct. So the evidence has shown that 50% of men at 50 years old will have an enlarged prostate or have some problem passing urine. And it goes to 60% at 60 years old, 70% at 70 years old, and as you guess, 80% at 80 years old. So there's a high chance that as you get older in life, as a guy gets older in life, his prostate will get enlarged and you'll have some problem to pass urine.
Right.
Now, we already know the problems to pass urine, slow stream, waking up in the night. You know, you can't hit the wall like you used to. Your stream is thinner. And these issues. But we want to discuss particularly the surgical aspects of when guys who are not fit for medication or have really enlarged glands that medication will not help, when we take them into the operating theater and we do some really cutting-edge laser surgeries on them and clear out the prostate, and now they're able to pee like a young boy in their 20s.
Right. So, you know, when people think about lasers, like the average person is thinking about like a laser from Star Wars. I want you to be a bit more specific and explain how the technology works.
All right, perfect. So when we speak about lasers in urology, there are many different lasers, just like there are many different cars. So the lasers, but I'm going to be speaking about one particular laser called the holmium laser.
Great.
And the type of operation we're going to be doing is called the HOLEP,
Right.
which is the gold standard in the top centers in the US and around Europe. It's called holmium laser enucleation of the prostate. Now, enucleation is a very big, fancy medical word.
Correct, yeah, break
And
it
it really
down.
means scoop out. So think of it this way. Just like how a Portugal has a skin around it and inside is the Portugal fruit, let's consider the Portugal to mimic a prostate. The outside green skin is the prostatic capsule and the inside is the prostate that causing the problem. So what we're going to do, just like how you take your thumb and stick it in between the skin and the fruit and get the fruit out, we're going to be using the laser to cut between the capsule and the prostate, separating it out, which is the fruit, and then we're going to suck it out, which is called morcellation. So it comes out like mincemeat. And the beauty of this operation is that, one, there's no cuts on your belly, so this is completely through a cavity, through the penis. Two, it's same-day surgery. Three, you come without a catheter, or you may have had a problem passing urine and they put a urinary catheter in, but I could guarantee you 91% of patients will leave the hospital without a urinary catheter.
On the same day.
On the same day. So I normally will do the operation early in the morning, and by evening time, by 5, 6, 7, the catheter is out and you're passing urine on your own.
And you get to go home.
And you get to go home one time. That's the beauty.
I mean, it's a wonderful operation. I've seen you work on it time and time again. But I want you to introduce our patient. Tell us about what this particular patient came in with.
Sure. So I have two cool patients that I would like you all to know about. The first one.
Let's talk about the one with the enlarged prostate first. I know you're excited, but...
So both of them have enlarged prostates.
Okay.
So having an enlarged prostate could cause you to have problems passing urine. But how about if we take a twist to it? Having an enlarged prostate makes you just pee frank blood. Imagine you wake up at night and you go to pass urine and you're just peeing blood.
Yeah, so that could be quite emotionally challenging and scary for somebody to see blood.
It's very scary. Patients come to the emergency department and they think they're going to die because, I mean, we don't know blood coming out from there. Nobody should be passing bloody urine. So
and with clots too, because a lot of them have
multiple
huge clots
yeah.
coming out.
So the two patients, we're going to discuss one with a very, very enlarged prostate. This guy has a very large prostate. It's a 487 gram prostate.
Wow.
All right. And he could not pass urine. He had a urinary catheter inside him. Doctors told him that he had to get a cut. They had to cut him open to take it out. So then he came and he visited us, and we did the whole up on him. We got it out, and now he's passing urine like a young boy. He cannot believe what he had.
Yeah, and
he's ecstatic.
He had no complications, right?
Zero complications.
It was a nice, simple surgery.
Yeah.
And he's a much, much happier person from what I understand.
Oh, and he's flowing powerful. And like I always tell my patients, when we finish do this operation, you're going to be pressure washing the yard.
That's a very nice visual, but thank you for that. Let's move on to the next patient.
And the next guy is a young guy who came into the emergency department after waking up after this passing frank hematuria. Hematuria means blood in the urine.
Mm-hmm.
And this freaked him out. And when we checked, he had an enlarged prostate and he was continuing to be bleeding. We put a 3-way catheter in. We washed out the bladder.
Let's tell them what a 3-way catheter is.
So a 3-way catheter has 3 ports. One port is to blow up the balloon,
Correct.
which keeps the catheter inside the bladder. The second port is to wash out the inside the bladder, and the third port is to let whatever you wash out run out.
So what we're doing is we're putting normal saline into the bladder to wash it all out, and then it will come back out.
And numerous clots after a multiple amount of washouts, it just was not settling. So I told him, here this. The problem is your prostate. And you're going to bleed. This makes no point. He has, when I took the history, he has problems passing urine for quite some time, and he was on medication. So this just goes to show, taking all the medication that's prescribed to help you pee better or to treat BPH may not always be the right cure for you. Medicine has to be personalized. There are some gentlemen that have very big prostates where tablets are just wasting your time.
And I actually really like the fact that you touched on that. Medicine should be personalized to each and every patient. We can't always generalize or go through what we read in a textbook and say it applies to everyone. Everyone is different. But now that we've talked about the fact that everyone is different, I want us to quickly go to break, and we will be back with another patient and more information. So don't go anywhere. We'll be right back.
Just 5 milliliters of blood. That's all it takes to unlock a complete picture of your health. At Medical Associates, we go beyond the basics with our wide array of options for blood testing, available only here. Whether it's for routine checkups, diagnostics, or monitoring ongoing conditions, our comprehensive blood lab testing packages are built for precision, speed, and peace of mind. From the moment you arrive, our professionals ensure a clean, comfortable, and efficient process. Our laboratory carries its own international accreditation with Accreditation Canada Diagnostics, reviewed against strict quality benchmarks, translating into information you can trust. We maintain international standards using state-of-the-art equipment in the highest level of quality control with rigorous testing. Your results, delivered fast and securely, sometimes within hours. We're here for every sample and every step. Take control of your health today. Book your test now at Medical Associates, the Caribbean's #1 comprehensive and internationally accredited hospital.
I was diagnosed with colon and liver cancer. Hearing the news, I was devastated. Having to go overseas, that could be stress and away from your family. Medical Associates, there was no other place to go, and I'm glad that I did, because they made my journey even better. I'm more comfortable. They made me part of the family. So besides my immediate family, I now have another family here. I was asking about the cost, and she was like, don't worry, we could organize. So that was a burden taken off of my shoulder. It was like a personalized thing. It wasn't just like the cost, because I've heard that it's so expensive to do this, but they treat you as an individual. I would like to thank Dr. Raghunandan, the office manager here, the nurse in particular who is here with me during the chemo, and Dr. Bim, and also Dr. Solomon, because he was the one that did the colonoscopy, but they made me feel comfortable. I would recommend Medical Associates because, number one, the care that you receive. They make you feel comfortable, and being part of a family besides your family. Of course, it's not that matter. What matters is to get you better. So I'm glad that I have this option here, and many other people will also have this option here if it is that they just do their research. For anyone who is going through this, don't lose hope, keep the faith, and know that once you have a positive mindset, you can get through this. Together with the medical staff, together with your family, it can be done.
At Medical Associates Oncology Unit, we know every cancer journey is unique and deeply personal. That's why our team of expert oncologists, nurses, and specialists are here to provide you with world-class care right here in Trinidad and Tobago. From early diagnosis to advanced treatment options, we offer cutting-edge technology and compassionate support every step of the way. We're here to guide you emotionally, mentally, and we understand how costly treatment can be. So, we have reduced our prices to assist you financially as well. Every aspect of your journey matters to us. With expertise you trust and care, you can feel Medical Associates, the Caribbean's #1 comprehensive and internationally accredited hospital.
Welcome back to Medical Associates Health Check. And today we've been talking about the surgical treatment of prostate diseases. So just before the break, we touched on the enlarged prostate and we promised you to meet one of our patients.
We did a whole up on him using the laser, and we went around the entire prostate, lasered out, sealed off all the vessels. Immediately, he had clear urine. He had a catheter for less than 24 hours. He went home that morning, the following morning, because he came in the night, with no urinary catheter and clear urine and no problems to pee for the rest of his life so far.
Okay, wonderful. But now let's go and meet him and let him tell us about his experience.
My name is Marcel Tardier. I'm 65 years old. I was diagnosed with an enlarged prostate and a bladder stone. My symptoms were started with uncontrollable urination, where I had to go very often and sometimes couldn't reach the bathroom in time. The symptoms came on fairly quickly, and that's why I took the decision to come and check and see exactly what was the problem. When we did the test and they told me it was enlarged, my prostate was enlarged and I had a bladder stone. Well, my wife was with me all the time, so she was the first person to know, and then after that, my children, of course. When you get diagnosed with enlarged prostate, the first thing you think is cancer, and one of the first things that doc told me when we had that is that let's see exactly what it is, and that's why we did a biopsy to see exactly if I had cancer of the prostate or not. Once that was done and we found out we had no cancer, that it wasn't cancerous, then the fears were, a lot less than if you have cancer, of course. We did a PSA test in the beginning. I think the same day we did the CT scan, we took blood samples to do the PSA test. And that showed the levels of the PSA test was high, which then we continued with the MRI, and that showed that it was a bladder stone, a very large bladder stone that was actually causing the root problem of the urination. But it also showed that my prostate was also enlarged as well. And that's why we did the procedure to test for the cancer in the prostate and figured out from there where we had to move, what other procedures had to be done. It was actually a biopsy, so to speak, where he went in. The procedure that he used, as I said before, was painless. And he actually took, I think, 36 samples of tissue from in the prostate and tested, and thankfully for me, everything came back negative. The whole procedure, as Dr. Armstrong explained to me, is painless. And most doctors tell you it's painless and you wouldn't feel anything. And you have to trust your doctors. In this case, it is painless. For me, it was, I had no pain from the procedure itself. After the procedure, the pain dies out from the first few days after you urinate, after the catheter is taken out, you basically feel like a young person again. It's, like if you basically could pressure wash the toilet bowl, and put it that way. If I had to choose a surgeon to do a procedure like this again with my urinary tract, definitely I'll come back to Dr. Hankerson. He is straightforward. He tells you exactly what needs to be done, and the procedure he's going to do. The same-day surgery is new technology, and it means that in most cases, I think it means that you do this procedure and you get discharged the same day, which I was, which happened to me. I came in at, as I said before, 9 o'clock in the morning, and I left by 10:30 in the night. And it gives you that for two reasons. One, you go home, which everybody wants to go home after they do surgery as soon as possible. And secondly, the costs attached to it, because if you had to stay extra days, then the cost just goes up. And medical bills are not cheap. My family has a long history with Medical Associates. We knew them when they first started here. And what I like about them is that they continually try to improve their service and their procedures that they perform to make it a better experience for the patient, and put it that way.
Just 5 milliliters of blood, that's all it takes to unlock a complete picture of your health. At Medical Associates, we go beyond the basics with our wide array of options for blood testing, available only here. Whether it's for routine checkups, diagnostics, or monitoring ongoing conditions, our comprehensive blood lab testing packages are built for precision, speed, and peace of mind. From the moment you arrive, our professionals ensure a clean, comfortable, and efficient process. Our laboratory carries its own international accreditation with Accreditation Canada Diagnostics, reviewed against strict quality benchmarks, translating into information you can trust. We maintain international standards using state-of-the-art equipment in the highest level of quality control with rigorous testing. Your results, delivered fast and securely, sometimes within hours. We're here for every sample and every step. Take control of your health today. Book your test now at Medical Associates, the Caribbean's #1 comprehensive and internationally accredited hospital.
AI technology is changing healthcare. And at Medical Associates, our new AI-powered MRI scans give you clearer images in half the time. And right now, you can get $800 off your MRI at our St. Joseph branch. So call us now to book at 662-2766, extensions 4072 or 4073. At Medical Associates, we make it easier to get the clarity you need with the care you deserve.
Our CT scan services are quick, comfortable, and designed to detect internal issues early, often before you feel a single symptom. Because the best way to treat something is to catch it early, and Medical Associates makes that easy.
Just call 662-2766, extension 4072.
You're in expert care at the Caribbean's #1 comprehensive and internationally accredited hospital. Don't wait for signs. Take control of your health with ease and confidence at Medical Associates, where care always comes first.
That must have been quite an interesting testimonial for you to hear about, but we're not done yet. Now, an exciting time. We'll get to go and meet Adrian's patients and find out about their experience.
My name is Gary Wong, age 87. I was suffering from stoppage of water, couldn't pee, and it happened to damage arm. I had to go to the nursing home, urgent treatment to get this pee out. And this I did it, and they put a catheter in me. It lasted about 2 weeks. After that, I came back to take it out. And again, I felt nothing. I didn't feel any surgery. I didn't feel anything. I came up laughing. I say, well, small thing, man. I say, small thing. And I tell them, call this one and call that one and tell them everything okay. I'm very happy today to see, well, I'm peeing again. And at my age, I'll enjoy the rest of my couple years which lies ahead of me. I will recommend if you have anything like what I went through, you go to a medical associate. They are the most comfortable place.
Adrian, that has been an amazing episode because it was really, really inspiring to hear everybody's stories and how they felt about the surgery, the treatment. And more importantly, I think it's good for us to see the positive outcomes from certain diseases that can cause so much bad press and media and can affect people. It can be a very emotional time for them. So it's nice to see them on the other side after treatment, feeling well and happy. I think that's key. So thank you.
It's my pleasure. And like I always say, the best part about doing this job is the smile on the patient's face after the operation.
I think I agree with you there. Adrian, we still have to talk about our patient with prostate cancer.
All right, so prostate cancer, from our epidemiological data, shows that it's the most common cause of death among men in Trinidad and Tobago, and also it's the most common cancer among men in Trinidad and Tobago.
Correct, yes.
So in your practice, you are going to see a lot of men who are going to come to you with elevated PSAs.
Mm-hmm.
You're going to do the proper workup. You're going to do your transperineal prostate biopsy, and they're going to be diagnosed with prostate cancer. Now, there are many different treatment options for prostate cancer, but what I'm talking about is the surgical treatment for prostate cancer, which is what we do, called a nerve-sparing radical prostatectomy.
And Adrian, why is that important?
Right, so why do we save the nerves? We save the nerves for two reasons. For continence, early continence, so that means you won't be dripping urine, and two, to get back your erections. So it's very important to save the nerves.
Right.
Now, these are gentlemen who was diagnosed with prostate cancer. They had intermediate risk prostate cancer. One had high risk prostate cancer. And we did surgery on them and how it has changed their lives after being dealt a death blow, as some may say, having prostate cancer, to now have a new outlook on life where they are over a year to 2 years out and they're completely cancer-free.
And that's pretty amazing. But what I want to talk about is your specific patients. Tell us about their stories.
Well, both of their stories are very similar.
Okay.
They both went by their general practitioners, routine follow-up, and investigations. They did was a PSA blood test, and the PSA was elevated.
Okay.
In one case, the PSA was elevated at 15. The other guy, PSA was at 5.
PSA is prostate-specific antigen, so it's a blood test marker that goes up when you see prostate cancer.
Correct.
Right.
So a normal PSA for the listener is less than 3.
Correct.
All right, that's the NCCN guidelines. That's the Cancer Network guidelines that we follow. However, in our patients, having an elevated PSA is warranted, and therefore you must do a workup. So we did the workup, we found the prostate cancer. And what we did, we offered them the options. And in both cases, both men said, Doc, I want this out.
Yeah.
Because if you do the surgery and there's any remnants remain, you could always do radiation and other treatments. But if you go with radiation first and then there's recurrence, doing surgery after could render you incontinent.
Yep.
So with that fear and knowing this data, it's always better to do the surgery first. And then if anything, you could always get your radiation.
Yeah.
So these guys had their surgery. It went relatively no issues, no hiccups. They were completely awake after the operation. One went home on the first day after his surgery. The other guy, which was because he was a little older, he went home 2 days after. Both gentlemen did well. Their catheters were removed.
Right.
And immediately after, you could see the difference in their life where they're completely continent. They were able to hold up their urine a few weeks out. And then after a while, their erections started to return. And these guys are back to normal.
And it's important because previously with older treatments, because the nerve isn't spared, they lose a lot of, their continence and their sexual function, which then led to emotional discord, not so?
Yes, that is a very well documented fact.
Yeah.
Now, some gentlemen, when you discuss the sexual component with them, they said, Doc, I use this thing long time, man,
Fair enough.
I don't need this again. But then that may be a very older guy. But if you pick up prostate cancer in a guy who's in his early 50s,
Which
and
you're
early
seeing more
60s,
and more
which we are
of
seeing
now.
more of, these guys are very concerned about their continence, and they're very concerned about whether they're going to get back their sexual function. Thereby, doing a nerve-sparing approach is the standard of care. It should be the standard of care. If you look at international centers, it is the standard of care. So there's no reason why in Trinidad and Tobago we can't make it our standard of care, which is what we do.
And that's the most important thing. We want to make sure that our practice matches what is the best or the gold standard across the world.
Agreed.
So until next time, because we don't have any more time.
That's not a problem.
I mean, if you give me the opportunity, I'll probably run all your patients through if they'd let us. But we don't have time for that. So thank you again for coming. And thank you for watching a very important episode. We really appreciate your support. As always, you can catch us on our social media pages, and we look forward to seeing you next time.
Just 5 milliliters of blood, that's all it takes to unlock a complete picture of your health. At Medical Associates, we go beyond the basics with our wide array of options for blood testing, available only here. Whether it's for routine checkups, diagnostics, or monitoring ongoing conditions, our comprehensive blood lab testing packages are built for precision, speed, and peace of mind. From the moment you arrive, our professionals ensure a clean, comfortable, and efficient process. Our laboratory carries its own international accreditation with Accreditation Canada Diagnostics, reviewed against strict quality benchmarks, translating into information you can trust. We maintain international standards using state-of-the-art equipment in the highest level of quality control with rigorous testing. Your results, delivered fast and securely, sometimes within hours. We're here for every sample and every step. Take control of your health today. Book your test now at Medical Associates, the Caribbean's #1 comprehensive and internationally accredited hospital.